Today we're going to talk about good sleeping position, and we're going to do it from 3 different positions. The first position is laying on your back, and the big thing to remember is you're hurting or you want to prevent injury or dysfunction, so we want to try and support all the places that don't have the support, like under your knees, under your neck, possibly your low back. So this position that you see Kathleen laying in is a good starting position to support your whole body. It does seem like you're using more pillows, and you'll see that we're using a towel, but those are all tools to help create a break for all your muscles by supporting them. So you'll see for her knees, she's got a pillow from the bottom of her buns, which we call your glute fold, to your knee or her knee, and a second pillow underneath that to her ankle. And what that does is it fills the whole gap from the back of her thigh and her knee especially all the way down the chain, so that her back ultimately can maintain a neutral position. Further up the chain, you see she's got a pillow, and underneath that you'll see a towel that we'll talk about in a minute. But the pillow, she grabs the corners of the pillow and pulls that up under the curve of her neck to make sure it's fully supported. For those of you that might have a little bit more forward posture, or your head sits a little in front of your shoulders, you might need a little bit more support, which is where the towel comes in. And for the towel, Kathleen is going to lift up the pillow and show you a good way to create a little more neck support. If you'll look at the pillow, or the towel, you'll see that it's scrunched up like an accordion, and she lays it flat on the bed, and then the top part that will actually be right under your head is flat. That's because your neck is more narrow than your actual skull. So if we call your neck the podium and your head more the bowling ball, you want the scrunched up part under the podium or the curve of your neck. So she places herself back in position with her leg pillows from her buns down to her ankles. The towel is under the pillow and the pillow is pulled up under her neck. She can feel a little bit more support under her neck with that towel scrunched up, and she'll just need to play with how much of that scrunch she needs, and if the pillow is moldable enough around her neck. But ultimately, this is a good start for laying on your back. And if you have troubles, you can adjust, but if you try this and then you go back to your old way, most of the time patients feel like this has been a really big help. So this is the supine, or laying on your back, modification for sleep. The second way of good sleep behavior we're going to show you is from laying on your side. Kathleen is in the position she likes to lay in when she sleeps, which is what most of us like to lay in, and that's on our side. The key here is to, again, support all the places of your body that don't have any support or have air under them, or however you want to think of that. Like, for instance, you can see at her ankle, there's a gap between her ankle and the table, and between her knees, she doesn't have a pillow, so you can see her top knee is really further below her hip. They're not parallel or even with each other. At her waist, because a lot of times people's waists are more narrow than their hips, then we're going to do a towel support under that, and her top arm is just kind of laying across her body. And if you had a sore shoulder, that wouldn't feel so good. So when we make this change, you're going to see a pillow propped under her arm, and maybe a little change with a towel, kind of like when we were in the laying on your back position. So we'll pause here and get her set up and then show you the modification. Let's look at the knees. We put a pillow between our knees to bring up her top knee so that her hip and her knee and foot are more parallel. She probably could even use a little bit more support under her lower leg just to get more even, but you get the idea of what we're headed towards. And don't leave your foot just laying on top of the other foot, because you're still going to have that rotation through your leg if you don't support your foot. So we put that second green pillow that you see under her foot to help keep more of that parallel line from her top leg to her lower leg. Moving up to her arm, especially those of you that struggle with shoulder pain, take the one edge of your pillow and prop it right under your armpit, and then scrunch up your pillow so it's fully filling the gap from your arm to your chest. That way the muscles in your shoulder aren't kind of on all night working, trying to keep your arm in place. They're allowed to just passively lay there, and that's a lot more comfortable for you. Kathleen's going to move that pillow though. Underneath her side, you see a towel scrunched up under the smallest part of her waist. This is to kind of support that gap in her waist, again to allow her spine to be more in alignment or parallel to the floor. So she's going to put that pillow back. And then for her head, she's got a good sized pillow that's moldable for her, pushed all the way up to her shoulder, but it's not placed underneath her shoulder. And that allows that more neutral head position. And then if you see the towel there, she'll take the pillow so you can see the towel. Same concept as when you were on your back. She's got it scrunched up so that part that's under her neck is lifting the pillow to meet her neck a little bit better, but the part that's under her head is more flattened out. So as she's laying here, just kind of looking at her relaxed, everything's looking pretty good, and we could possibly put a little more support under her foot and knee to get that a little bit higher. But don't be afraid to use more pillows and towels to get you comfortable, because good sleep means you're going to heal better, you're going to feel better, your mood's going to be better, and it's worth it to take the time to get yourself set up. The third position for sleep we're going to talk about is probably the more scary position for sleep, just because of the risk it puts your vertebral artery at. But Kathleen is starting in this position. She's not propped up, but you can see if you're going to sleep in this position, it puts your neck in an extension, especially when you're turned off to the side and you have an artery that runs in your upper cervical levels that gets pinched off in this position. And this position actually puts you at 70% risk of stroke. So it's something that you want to get out of. And if this is a position you like to find yourself in sleeping, then we can figure out ways to make it be a little bit more adaptable and take a load off of that neck and also support your back a little bit. So we'll get her propped up and then we'll show you what that looks like. Get you propped up right. So you can see that Kathleen's neck and head are pretty parallel to the floor with that pillow under her head, so she's not getting in too much extension. Then we put another pillow starting from her armpit and fully supporting her whole arm and hand. And then the green pillow is a little bit under her belly, mostly under her hip and thigh, filling in whatever gap there is so that her whole belly button on down is supported by that pillow. And then there was just a little bit of a gap under her ankle, so we just filled it with a towel, and that helps her feel a little bit more aligned. Again, if you're not sure if these are working for you, try these at home and get you propped up, and maybe have somebody help look at you how you're sleeping, or your therapist can look at you how you're sleeping, of course, and help you, and then take your pillows out and see what that feels like without them. And for the most part, you'll like the changes with the pillows, and you'll be in a better position for your spine and taking a load off your neck. And certainly if you're on your belly, you want to not put any more risk on yourself for stroke if you can help it, but also just headaches and different issues like that happen when you sleep on your belly and have your head in that extended position. So these are the 3 different ways to modify your sleep. And if you have any questions, don't hesitate to email us at Agape, and we'll certainly answer your questions.